So your
May I
question
repeat
is
the
very,
question?
no, it's okay.
No.
The answer is very pertinent. What you asked is that without knowing your status, COVID status, how are you going to interact with your elderly people in your house? So basically, what I'm trying, if you suspect that you have come in contact with a COVID positive patient or somebody who's COVID positive, or you are a healthcare worker who is at high risk the infection, or you have a travel history, you're coming from a epidemic area. So if the index of suspicion is high, then obviously it is do not interact with these people at all. But if you feel that you are not, neither of those, but still you can be positive. So it is better that when you are actually interacting with an individual, which could be your parents because they are higher age group, it is better that the mask will be there from both ends, because and you maintain a talking to them, because what is going to happen is if both are masks and if you maintain a distance, the chances of the virus, even if you are positive, transmitting is extremely low. That's the only thing we can do. But if you have got fever, if you have any symptoms of COVID, definitely you will be not going to near these people at all. The home quarantine or your room quarantine has to be looked after. If possible, some people are doing that. They're shifting yourself to a facility where actually and there, and your parents and the other high risk people are staying at home. So that is also a possibility. Some hospitals are actually taking a step forward and renting some places where they're actually putting this COVID positive asymptomatic patients for quarantine for 14 days, so that they are exposing themselves to the high risk individuals inside their homes.
Thank you.
In that case, Deb, Arogya Setu app can be helped.
Arogya Setu is actually depending on whether you have tested, your data will be transferred onto the Arogya Setu app. It will be uploaded, and if you have your Bluetooth on, you can actually exactly how many people are around you, but it will not tell you who are the people who are actually positive. It can only tell you within 500 meters, within 1-2 kilometers and 10 kilometers if there are any people who are positive, but it will not tell you who are the people who are positive.
Now, in that case, close to me, is he affected or not? Can Arogya Setu can tell?
No, Arogya Setu, if you are positive, Subhidha, and if positive means you have been tested in a center which is recommended and approved by the ICMR. So they automatically, once you are tested positive, you along with your address will be uploaded on the site. So it will show if you put your Arogya Setu app on that you have 5 people meters who are positive, but it will not show that who are these 5 people are.
Understand. Thank you.
Yeah, doctor, I heard many of these other cities. I mean, someone was telling me in Ahmedabad, they've got these facilities provided by some group of doctors or a team of doctors. The whole facility, if you have a adequate kind of a situation in your house, a separate room, flat, in a flat, they're actually setting up the whole hospital-like facility at your house and then on to attend you for a charge, obviously, those who can sort of afford it. I mean, do we have anything of this type happening in Calcutta?
Yeah, it is theoretically, but the thing is that if you are living in a community and you're trying to set up a hospital-like facility within your building, there is a lot of logistical there, because
I'm saying for a one individual who's having some problem and he wants to.
Yeah, I understand, but if you are living in a community, the community might not approve these kind of ideas, because it all depends on the mindset of the community. Because as you understand, that a lot of people are stigmatized with this coronavirus. So we hear a lot of stories, about doctors, about nurses being thrown out of their rented apartments. So this is happening. If that happens, Even I know of people when we had some facilities of some people going and to the house and testing only. So there also they have created problems. Unit, theoretically it is possible because we are giving oxygen and heparin, nothing more, and IV fluids, nothing more. But logistically, this big challenge, depending on the mindset of the people we are living in.
Doc, recently we have also heard that there is symptoms with skin rashes. Is it true? Skin rashes are coming due to COVID-19?
Yeah, skin rashes, diarrhea, headache, kind of the loss of smell, loss of appetite. So as the days are progressing and the virus is mutating, it is causing different kind of signs because this virus, when it first came, it came with a set of symptoms. Now the symptoms are actually getting very, very varied. So basically, if somebody has, it could be due to something else. But how can you say that a skin rash is coming from COVID or not? It's a very, very difficult thing. But I think the main important pillars of COVID-19 would be still fever, cough, shortness of breath. These are the three pillars. Along with it, if you have somebody has skin rash, if somebody has diarrhea, loss of smell, loss of taste, those could be associated symptoms. But isolated, just a skin rash should not put you into a suspicion of COVID-19.
Arnab this side. Sorry, I joined late.
Yeah, Arnab.
Two things I want to ask.
Yeah.
Point number one is that there are now, as you could see, yesterday there was around 70 to 75% of the new whosoever getting detected for corona are asymptomatic patients. So, can you tell me that detect an asymptomatic in the sense, what are the how do you know that I am an asymptomatic patient or something like that? Is there like for a corona patient, these are the
They said if you are asymptomatic, all you have to do is actually think about the circumstances you are in. Suppose you have visit is corona positive. Suppose you have traveled from a place where there is an epidemic. Suppose you are a health worker dealing with corona positive patients. So basically, these are the population where there is chances of being positive. So it is impossible to know whether a asymptomatic patient is actually corona positive or not. That is not possible. So the circumstances which you're coming from will give you an idea whether there's a possible being positive in the coming days. Otherwise, there is no way.
Okay, so you're saying that it is only if you're coming from that zone or if you are meeting those people, then only this criteria comes
today
up.
Theoretically, the way we stand on up, theoretically the society, everybody has a chance of being positive because we everywhere. The coronavirus is everywhere. If you move out of the house, you have a problem. If you are inside the house, if people come into your house, like domestic helps and drivers and many other people, even a milkman or somebody who's a delivery boy. So theoretically, everybody can actually transmit the virus to another person. So the way next couple of months, this asymptomatic positive could be a very, very high number. And the only way you can find out is actually if you are suspicious or if you are come in contact and you test yourself and you find yourself positive. So that is the way you can find out.
Okay, that is the only way out.
Yes,
right?
Yes, absolutely.
Okay. Okay. Now the second question is that, for example, I'm into sales and marketing, right? So now also we are mostly into net meet and all these things, but then also I have to visit maybe in a week or maybe once or twice to a client. So what is the ideal gear or how you like? I wear a mask, I wear a shield or something like that, wear a gloves and go. All what you do, or some people say that don't wear a gloves because if you wear a glove, the chances of this thing, the getting into the virus is much more higher, or white shield or something like that, because you'll tend to touch that shield or something like that. So I want to know, is this the correct gear, and how, in the sense that although I'm not using a public, but what is the correct distance of, we have to do it as a part of our professional barricade. So how do you move on to that? How in the sense you move on.
No,
With the current.
staying at home option is getting redundant as the days go by. Because if we are going to
Yeah.
live with this virus for the next couple of years, staying at home will not be an option for you, for me, for anybody, in fact. So, what we can do is maintain the correct procedures. So, you are absolutely correct. Today, you are meeting one client a week. It is going to happen that every day you'll have to meet client maybe in the coming months. So, what is going to happen? It requires the awareness sides. If you are only aware and the other person is not aware, it's not going to work. So it is on you to make sure that the person you are meeting also follows the same principle. So first of all, masking, particularly I recommend at least double or triple mask, which means cotton mask. You do not have to wear
Acha.
N95s or any valve mask, because that is
You're
only
saying
double masking, and use cotton mask and cover properly.
Cotton mask.
Cover your nostrils, your mouth, and fully up to your chin. A lot of people,
Okay.
what they do is cover the mouth and not the nostrils, because nostrils is also the way you can get in. If you are wearing a specs, that's fine. If somebody is not wearing a specs, then it is better to wear thick specs. That is available, and on top of that, you wear a face shield as well.
Hello.
Hello.
Yeah. Sorry.
Wear a face shield as well. And I do not recommend wearing gloves, because gloves is something which gives you a false sense of security. It is better you have your.
When you touch, what happened when
Yes,
you touch and
yeah, you can
something
touch
like that?
anything. You can touch
Maybe
anything you want.
you're going to a client's office, you are touching the door and opening it up. So that's what I'm
Absolutely.
saying.
You want. Arnav, you can touch whatever you want, but do not touch that hand onto your mask and to your nose and your mouth. If you are touching everything, that's fine. But before you open your mask, you make sure that you wash your hands with soap water, or you use alcohol sanitizer, because it is not possible for every second to use a sanitizer. So once you are out of the house, you touch, but with that hand, do not expose yourself to the nostrils and the mouth, because you have the mask on top of that. So that
doctor,
is the way to do it.
If I can infer your way now, so if I go with an open hand, say for example, I'm not going into gloves, and for example, I meet up a corona patient or whosoever maybe he shook hands with me, right?
You don't shake hands. No. You do not shake hands anymore.
No, it's not shake hands in the sense that he touched me or something like that. It just happened that some touch, just like that happened.
Yeah.
So, why? For example, he has touched the road, the entry door. For example, he has gone inside 2 minutes earlier. I went in 2 minutes later. So both of them have a door office, right? So why I'm saying this, that I was thinking that if I wear a gloves, then my hands will be safe if I have to touch all those things. So now you're saying you can come back home and you wear and wash your hands with
wearing a glove is very good in the initial days, but as the time wears on, wearing a glove feasible option. It is not going to be, because how many pairs of gloves will you use per day? That is not feasible. But you can wash your hands many times a day. So we as this journey of coronavirus, COVID-19, we will have to adapt ourselves to very practical ways. That is the most important thing. See, the children have not come to have a couple of teachers in our group today. The children have not come to the schools and colleges yet. So the biggest challenge, I believe, in the coronavirus, especially when the trains open up and when the children are actually going to the schools, colleges, and universities.
Goes to the school.
That is going to be the biggest challenge, because India depends on railway, unlike Europe, which depends on road transportation. And our universities, children, and the associated industry probably contributes to at least 50 to 60% population range. So what we see today is actually 30 to 40% of India is running. Once the children comes to school, then the real challenge of the COVID.
There was an article 2 days back where it was saying that herd immunity can only happen if more and more people go to the marketplace or something like that. There was an article that like most of the Indians are staying back at home. where it is the most stringent lockdown across the 67 days of stringent lockdowns. People are saying that if you go more to the market or more to anywhere else, probably herd immunity would be there, and maybe disease will not spread that high. Is this correct? I read this article just 1 or 2 days back.
Idea-wise, the disease, this idea is fantastic. But the thing what happened was Boris Johnson, he dismissed the idea of lockdown, and he went for herd immunity concept. And you see the catastrophic events which happened, died like fleas, absolutely, in hospitals, in roads, and nursing homes. So what is the problem with herd immunity is we require 80% of the population to act virus and develop antibodies, which is virtually impossible because the antibody is going to stay with you only for 3 months. So by the time you are positive and you become, and 3 months have elapsed, your antibody level is going to be 0. So you can never achieve that magic figure of 70 to 80% of population in totally I believe this herd immunity concept is a very good concept on paper, but it has never worked anywhere in this world so far.
One thing, just adding, he was saying, what you're saying is only the mouth and the nose has to be protected. So the eyes and the ears have no issue. You touch
ears, Ashish, has no issue, but eyes, there is a theory that you have to protect your eyes. So people who are wearing glasses do not require any particular protection. But if you are not wearing glasses, you can have your plastic glasses, and the face shield is actually a very good barrier. So using a face shield and washing them every day is a very good barrier. And the other thing about masks, I must say, to be used and not thrown away, but it has to be washed and sun dried. If there is no sun, you can put it in a microwave and actually dry it as well. So it's a very important thing. So one pair of masks is actually never enough. You require at least 4 or 5 pairs of cotton masks. So it is very easy to make. So keep cotton masks, identify and wash them, sun dry them or microwave them, and then put it back again.
How many, basically one mask for how many, outings or something like that?
You go out and you come back and you wash it.
No, wash it, and after that, how many times you can use that?
You can wear it. Cotton mask is like wearing a shirt.
Okay.
Yeah.
Dr. Deb, I believe in this year, school college will not be opened. So there is infection. Hello.
Yes.
I believe in this year, school college will not. So there are no question of infection in that zone. School and college.
Yeah, but Subhida, this year is only another 6 months away. Coronavirus stays with us for the next couple of years, which people are predicting. Then, at some point of time, we have to open up because I'm sure in this panel already they will agree with me that online classes, couple of things I have a problem is, one is the penetration of one online classes, how much it is penetrating, and secondly, the quality of actually the interaction which happens in the online classes is pretty debatable, I think. And online class abandoned in USA from today. Donald Trump has told no more online classes for any students. So as the world is moving on, I think a time will come when this online will have a place, but it cannot be a substitute for face-to-face teaching. So there has to be SOPs which has to be made in days to come, because this is a good time when the children are actually at home for the teachers and the authorities in the teaching institutions and the universities start making these SOPs, the standard operating protocols for every school, every college, every university. Because if you suddenly decide to open up the school and universities and you do not have SOPs, it is going to be another mayhem. Because believe me, when the elderly people are dying, people are still taking it. It starts dropping dead. I think it's going to be very, very messy. So yes, I think my appeal to the education and the leaders who are actually looking after the education, that please start making the system the SOPs about for your schools, colleges, and universities, because it will take time. And please take the help and support of the medical community, because you alone cannot make a SOP, because it requires to have the medical in. So based on the ICMR and the WHO guidelines, we have to make along with your teachers the SOPs for the school children.
Doc,
Wouldn't
you're
like
talking about this mask, what the cotton mask and the normal mask, which I am asking the normal surgical mask, which is available in the normal medicine shop. If I do it in a double folded way, is it a work?
It is going to work, but the surgical mask is good, because you cannot reuse the surgical mask. You wear it once and throw it away. Because the surgical mask, which like this one, which we use in the hospitals,
Yeah.
you have to throw it away once you use it. It's not going to be a very viable proposition using surgical masks in a longer period of time. I don't think so.
And what about this N95, which ISMR or the
N95 is actually meant only for healthcare workers. People who are actually treating patients with COVID-19 in the hospitals, and people who are actually caring the COVID-19 cases. So these are the people who will require the original are very expensive, and we have got very limited stock. The rest of the masks which are being used with valves and everything are only for industries, where you can actually have the particles, large particles of pollution and all, which will stop. But the viruses is not going to be stopped by the filters, which are masks with valves. So valves with mask is a complete no-no. N95 for general population is a no-no. So surgical mask is not viable. It is effective, but not viable. So the only thing left is a cotton mask, and double layer, triple layer of cotton mask is good enough.
What about cap? Is it necessary to cover your hair and something like that?
I think it's a good idea, because though there is no known transmission with hair, but I always tell people to cover up completely when they're out in the streets, because you really don't know. Tomorrow, maybe in a month's time, data is going to come out that it is also transmitted by hair. So if you're going out and covering everything, there's no point in actually not covering the head as well.
Dr. Deb, Wildcraft mask, which is 6 layers mask, is it useful? I mean,
6 layers is going to suffocate you. So with that, two layer or 3 layer used properly,
two layers.
That's enough.
Two layered mask is good. I mean, wearing mask is not a very easy thing, because we have been wearing masks since the last 3 decades in operating rooms. We are used to wearing masks, but people who are not used to wearing masks have a lot of trouble wearing masks, and most of the people are trying to pull it down. I mean, that is. And I've seen people who are actually pulling down the mask when they start to talk. This is exactly when actually require the mask to be off. And the other thing is, when you are going to office in your workplace, I ask them to have your lunch separately now, because we cannot have a lunch or any meal with the masks on. So whenever the masks are down, if you are alone in your own cubicle having your lunch. So basically, human interactions without masks, I ask not to do at the current phase of time.
Okay.
I have a different kind of a question. Like, there's a theory that this COVID situation is part of a biological war started by some country, or started by a particular country. So do you think, as a doctor, this is actually possible, or it's a rumor?
I would not, there is no proven theory on this, but the coronavirus, which is actually causing the pandemic in this world, has the natural has not been found yet. The closest to the coronavirus which has been identified is from the bats, but the coronavirus which is identified and the coronavirus which is causing the pandemic has got a few differences. Few amino acids have been replaced in this particular pandemic virus. So there is a theory going on. This coronavirus is probably a virus which is being manufactured or tweaked in the laboratory. So it is called the bioengineered virus. But we solid data on this conspiracy theory. people are telling about this, and we have not found a source yet. So people are talking about this bioengineered virus, but we identified the genome of the virus where the amino acids have been replaced by something else compared to a bat virus, bat coronavirus, which is the closest to this virus.
No. And doctor, what about the vaccine that's being given that by 30th or by the month of October, Serum will give some for 30 crores of vaccine, whatever the owner told some few days back on the interview.
The
Post
Poonawala, I think,
Oxford. Yes, Serum
yeah.
Institute. Post
Serum Institute
Oxford.
of Pune.
They said that some will be able to give doses to Indian this thing, and the balance
See,
will be given by
basically,
the first quarter of 2020.
any vaccine is not a miracle drug. Vaccine is which is being injected into your body, inactivated virus injected into your body to elicit an immune response, which means to elicit some antibodies against that virus. So that's a small dose. So basically, phase 1 and phase 2 trials, which are going on at the moment, and the results of the Oxford results have come out. It is only done in a very, very small a few hundred people, and they are normal volunteers. So extrapolating the data of phase 1 and phase 2 trials to the complete world, where you have different diverse population of different age groups, different medications, different diseases, it is impossible. So phase 3 is the most important trial, which is actually on. Until the results of the phase
How
3
many
trial
people
comes,
for phase
it will
3? How many
phase
people
3
for phase
it
3?
will be few thousands, and not only the number.
Okay.
I think in phase 3 trials, what they're going to do is going to include the elderly people, the
Achha,
young people,
age
age
group.
group also, and also people who have got high risk. Then only the efficacy and the side effects are controlled. Then only we're in a position to tell that we
Correct.
can go to phase 4. Phase 4 is a bigger size. So as long as come up, and what is the problem with this the vaccine is, by the time the vaccine comes out, the virus is so notorious, the RNA virus, it is mutating completely. So you're giving the vaccine, maybe it is possible that the virus which you intended to give it for, that virus has completely changed. So this is a waste of just a little bit of into the patient. So these are a lot of possibilities which are running into people's mind. So until the thing comes out completely, it is impossible to tell. WHO has today that the earliest Americans can get this vaccine is sometime in the middle of next year. That's what they have told. So let's wait and see for the results. There's no point in hypotheticating
Now
what
there are
happens.
five contestants. I mean, they're in the pipeline and who are running for
150 people were in the vaccine race.
Acha.
There are
Okay.
Russians, there are Middle East people, there are UK, Americans, Indians. So
Acha, 5 are
every
top
country will produce
contenders.
a vaccine.
Sorry, 5 are
Yes,
top contenders are there. Including Indian one that who has been tested
Bharat vaccine.
Bharat, because I heard from a distributor in Patna that in AIMS Patna they have been group of people has been given some 3 days or 4 days back. That is the phase 1, I guess. They're testing it in the human.
So lot of actually companies. What happens is when a virus, the earliest is the mumps virus vaccine, which has taken 4 years. That is the earliest we have done. After that, it is 9 years, 18 years, 35 years, 3 years. That is the time frame usually for a virus, for a vaccine to come up. So basically, if you can come up with a vaccine within 6 months, it's a miracle. But let's hope for the best. And I don't think we have anything more to say until the real thing comes up. And the important
until
thing
the phase 3 picture comes up.
And the important thing is, the first thing them to get the vaccines are actually the developed countries, because they've already bought those vaccines. They've already booked it rather. So the general population in India, when they're going to get a vaccine is anybody's conjuncture, because it is no good if you get a vaccine. See, there is no point that if you have your neighbor doesn't have a vaccine, it is not going to serve the purpose.
No, they have said that in India it will come in the phase wise. Like first will be the person's persons, then the medical staff welfare persons. I mean, the people who are at the forefront, then the police, then something that they may have made a bifurcation of the same. That's what I was.
Yeah, but that is
one of the Navneet's
that
question.
paper. You know what happens, what will happen in India, you can understand. I can jolly well think and imagine what is going to happen in India if the vaccine comes.
Yeah,
Dr.
you never know. Correct.
Dr. Dev, is it is required for the house? I mean, is it necessary?
Yes, I think Subhida, oximeter, if it is possible, it is to get an oximeter and check the oxygen, fever, and cough and all, because as I mentioned before, that any oxygen saturation below 90% on room air will have into a hospital. That is the recommendation right now. So it is better that that if an oximeter is available to have it.
Doctor, why is there a variation in the mortality rate in different countries? For example, we have seen a mortality of 10% somewhere and 2% somewhere. Is it because
It is actually a percentage. It is not an absolute mortality. We do not discuss an absolute mortality rate. We are discussing a percentage mortality rate. And percentage mortality rate will positivity you have. And how much positivity you have depends on how many testing you are doing. So countries which they have tested a lot of patients and positive, their mortality showing different. And countries where actually the testing is less and the deaths are there, their mortality rate is percentage wise it's going up. So basically, if you tell a lot of positives are there, which are asymptomatic positives, there the mortality rate is going to be 2.5 to 3%. But states and countries where the testing is less, percentage wise is going to go up because you are not picking up a lot of asymptomatic positive patients.
Okay, Doc, I have
a question.
Yeah.
Yeah,
go on.
See, in high-rise buildings where the cases are increasing, like we have 4 in our building already. What should be the normal protocol? I mean, these people taking normal precautions. At the most, the common thing was that they were coming up and down by lift. Otherwise, there's no other place where we had a common interaction or where we can. So, what are the protocol that we need to follow? Now, after that, they're in their houses, so that's fine.
Basically, I think if your building has a positive lift, basically the first thing to do is actually notify your authorities, and they will make sure that the people from that particular household doesn't come out, and nobody goes in. One thing. After that, I think what you need to do is sanitize the lifts. So that is the most important thing. But be for sure that once you are positive and you positive, which means that your contact must have happened at least a week ago. So you have to trace the contacts. If you have gone into that house maybe within a week and now you have found that somebody, there's a chance that you would have also been positive after a week maybe. So that's why I'm telling you that every household should actually wear masks when they're going into a fear which is not known. So wearing a mask and also the other person wearing a mask is extremely important because that is one good barrier between the virus and the.
Okay. And Doc, I have a question. Like people like us, those who eat non-veg, so do animals get contracted by coronavirus?
It is not a zoonotic transmission so far. It might originate in an animal, and from animal to humans muted, the virus is completely mutated. It takes a different form. From now on, the virus is actually transmitted from humans to humans. There is no evidence showing animal to human transmission, particularly through a food chain. Or if you have a pet living at your home, that if you are a corona positive, the chances of the pet was also probably not there at all, unless there is some few cases here and there.
Okay, thank you. কোয়েশ্চেন করছেন শোনা যাচ্ছে না
তাহলে ওনাদের এটা মাইকটাকে আনমিউট করতে বলো যদি কেউ কোয়েশ্চেন Please unmute your mic and ask the question.
No. Achha, Doc, Bipasha Roy had asked a question. But without your permission, I replied to it. Since you covered it, she asked whether a survivor, COVID survivor, can can get infected again. So I said, as you said, yes, since the antibody is very weak, so he or she can get infected again. So I hope that's right.
Bipasha is actually my sister. She is probably joined a little bit late, I think.
Okay. So I already replied to it without asking your permission.
Sure.
ডক্টর দেব একটা জিনিস সাজেস্ট করুন আমাদের, আপনি তো জানেন আমাদের ক্লাবের আর ইন ওড়িশা, তো যখন তাদের কল করা হবে সিচুয়েশন নরমাল হলে, তখন ফার্স্ট স্টেপ আমাদের কি কি করণীয়? আই মিন
মনে হয় যে what we need to do is once they come over here, probably all of them will be tested once they're crossing the borders. It is better that once they come over here, that they have a test report from an authorized center from where that is to ensure that you do not have surprises when they come over here. So, and that report validation is only 48 to 72 hours, not more. So anybody coming from Odisha or neighboring states, I think they should get a test report from an authorized center. That is very, very important. A lot of centers are doing this, but it needs to be done from an authorized center, and the validity of the report is going to be 48 to 72 hours. And once they arrive here, if anybody has any symptoms, cough and cold, they should be immediately quarantined, because still now people coming from different states are already being quarantined for 14 days. So that
is mandatory.
So within this time, I do not think anybody is going to come. So once the quarantine thing goes off, then probably people will start coming into different jobs from different states. But definitely they have to come with a report. Otherwise, what is going to happen? The whole burden will be on the receiving state to ensure that they are actually corona negative.
Thank you.
We have only 1.5 minutes left. So if anyone wants to.
I think we'll wind up the session, and thank you so much for giving me an opportunity.
It's a very beautiful and very effective session.
No, I'm also very happy that so many people have come, and a lot of known people are with me. And
thanks
I'm
to
thankful
you and
to Lake Club giving me the opportunity to be interacting with you. It's been a pleasure, and I hope that if required, and if anything updates are coming, we can actually take a bit interact. So this is something which we need to do on from time to time. It's very, very important.
That is very necessary.
Thank you, Doc. Yes, the only thing, Doc, if as you offered, so probably we'll try to meet once again after a week or 10 days, when you will be free. So we can Lake Club people, because we have so many groups are there, so they are also waiting for any advices from you. So it will be helpful for them also. One of our having friends, Shubir Okachene, Gautam Chaudhary and wife, both of them are COVID positive. Now they, as I heard, because they are friend of mine, Shubir tumi cheno, Gautam Chaudhary and Mekla Chaudhary. So I think so. Both people are interested in advice